Hi, my name is Craig Cruz. I'm a physical therapist at Achieve Sports Medicine. I also serve as the clinic manager of our Willowbrook location. I've been a physical therapist since 1998. Over the past 25 years, I've also had the privilege of participating as an athlete at the high school and collegiate level, as acting as a football coach at the youth and high school level, and acting as a strength coach at both the collegiate and high school level. Currently, I also compete as a master's athlete in track and field and in Olympic weightlifting. Over the years, I've had my fair share of injuries. I've been able to rehabilitate them using a very systematic and logical approach, emphasizing mobility and a balanced strengthening program. Today, I would like to talk to you about the importance of ankle mobility as it pertains to knee pain. Athletes place a lot of stress on their knees when running, jumping, cutting, and squatting. Ankle mobility is a key area to evaluate and treat when someone is complaining of knee pain, especially when it is a non-traumatic in origin. When an athlete is unable to adequately bend his or her ankle, she will place an increased amount of stress on their kneecap or patellofemoral joint. I prefer to assess an individual's ankle dorsiflexion or ability to bend their ankle in several different positions. Sitting with their leg straight, sitting with their leg bent, standing statically with their knee bent, and standing dynamically while bending their knee. I would like an athlete to obtain more than 15 degrees of dorsiflexion with their knee straight and more than 25 to 30 degrees of dorsiflexion when their knee is bent. It is also vital for an athlete to have the ability to obtain adequate ankle dorsiflexion during dynamic activities, since their sport is played on the field and is not played in the physical therapy clinic. I typically incorporate ankle mobility drills at the beginning of a training session, during an active rest period during the training session, and at the end of the session. Here are some of my favorite ankle mobility exercises. Seated toe lifts. Sit in a chair or on a bench with your knees bent. Lift your toes and foot up towards the ceiling. Pause for 2 seconds. Perform around 30 repetitions. Seated toe lift and eversion. Sit in a chair or on a bench with your knees bent. Place your hands on your knees to ensure they do not move. Lift your toes and foot up towards the ceiling. Turn your foot, ankle, and lower leg outwards. Pause for 2 seconds. Perform up to 30 repetitions. Two-way calf stretch. Your calf is made of two muscles, your gastrocnemius and your soleus. The gastrocnemius attaches above your knee joint. The soleus attaches below your knee joint. It is important to stretch your calf in both a straight leg and bent leg position. You can use a slant board to effectively stretch, but it is not mandatory. Place your heels on the floor and your toes on the slant board. Keeping your knees straight, lean forward, feeling a stretch in your calf. Hold for 30 seconds. Repeat up to 3 times. Next, perform 3 repetitions with your knee slightly bent. Visualize the position you would be in while snow skiing. Ankle mobility at the wall. This drill can help identify any asymmetries commonly seen between ankles. Stand facing the wall. Place your hands on the wall. Place one foot forward, assuming a semi-lunge position. Place the front foot 3 to 6 inches away from the wall. While keeping your foot flat on the floor, bend your ankle, knee, and hip as you try to touch your knee to the wall. If it is too easy, move backwards. And if it's too hard, move forwards. Repeat 10 times. Repeat with your other leg. Ankle rocker squats. This drill helps with both ankle mobility and lateral hip stability. Stand on one leg, Have your arms straight with your fingers pointed down toward the floor. Bend your ankle, knee, and hip. Descend to a maximal depth while maintaining a parallel relationship between your trunk and shin. Pause for 2 seconds. Perform 10 repetitions. Repeat with the other leg. Kneeling 3-way ankle. Assume a lunge position with one knee on the ground and the opposite foot out in front of you. Place your hands on your front knee. Bend your front ankle, moving your knee in a straight line beyond your toes. Perform 10 repetitions. Repeat the exercise, angling your knee inwards towards your big toe. Repeat 10 repetitions. Repeat the exercise again, angling your knee outwards towards your pinky toe. Repeat 10 repetitions. I like to incorporate some of these exercises during all parts of a training session. I will use them as part of an active warm-up, between sets of exercises such as squats as part of an active productive rest period, and after a session as part of an active cool-down period.